Hey everyone, my name is Jacob Steinle. I'm a third year psychiatry resident at WashU in St. Louis and the primary author of our recent article in the Journal of Clinical Psychiatry titled Confounding of Hallucinogen-Psychosis Associations by Baseline Psychiatric History. As we sit on the precipice of the psychedelic renaissance, the conversation around these substances is shifting from counterculture into the clinic. But with this shift comes a significant safety debate. Does the use of psychedelics, substances like psilocybin, LSD, or MDMA, actually cause psychosis? Or are these hospitalizations simply catching people who are already on a trajectory toward a psychotic disorder? Our research aimed to explore the who behind the what by looking closer at the complex histories of these patients. To understand the context of this work, we have to look at the broader landscape. On one hand, some large-scale studies suggest psychedelics have a relatively benign safety profile. On the other hand, there have been several scholarly articles and media reports that have found a strong association between emergency room visits for hallucinogen use and the subsequent development of schizophrenia spectrum disorders. In the scientific community, these mixed results create a challenge for both clinicians and policymakers. We believe that a missing piece in much of this epidemiological data has been the full scope of a patient's psychiatric history. Often, research relies primarily on hospitalization data. However, psychiatric illness is more often managed in outpatient clinics and therapy offices long before it ever leads to an emergency room visit. We aim to see if accounting for that broader longitudinal history would change the story. Using the Merative MarketScan Medicaid and commercial claims database, we analyzed a cohort of over 270,000 individuals who had a substance-related admission between 2015 and 2019. This specific time frame is crucial because it precedes the widespread decriminalization and current resurgence of psychedelic therapies. It gives us a clean baseline of how these substances were interacting with the population before the policy landscape shifted. We compared two groups, those admitted for hallucinogen-related reasons and those who were admitted for other substances such as opioids, stimulants, or alcohol. We then tracked who received a psychosis diagnosis between 30 days and 6 months following that initial visit. But importantly, we also looked backward at their records to see what clinical baggage, what baseline vulnerabilities they were carrying before they ever walked into the hospital for that hallucinogen-related issue. When we looked at the raw numbers, the risk of psychosis appeared quite high. Individuals in the hallucinogen group were more than twice as likely to have a post-index psychosis diagnosis than the general substance use cohort at 16.4% versus 6.6%. In an unadjusted model, this looked like a significant 22% increase in risk of psychotic disorder diagnosis. However, when we adjusted the models to account for baseline psychiatric history, specifically prior diagnoses for mood, anxiety, and existing psychotic disorder diagnoses, the association became non-significant and the hazard ratio dropped from 1.22 to 0.97. Essentially, the risk of subsequent psychotic disorder diagnosis vanished once we accounted for the fact that the people experiencing this adverse reaction were disproportionately likely to have a pre-existing psychiatric vulnerability. In fact, nearly 20% of the hallucinogen group had a recorded history of psychosis before their index admission. So, what does this mean for the practicing clinician? If a patient presents with psychosis after using a psychedelic, our data suggests that the first move should not be to attribute the symptoms to the substance alone. Instead, one should look at the longitudinal history. Is this a new onset, or is it a crisis point in a burgeoning psychotic disorder? These findings emphasize that screening matters. For those involved in psychedelic-assisted therapy, screening must go beyond asking about prior hospitalizations. It requires a deep dive into outpatient and family history, as these appear to be the true drivers of risk. Additionally, we found that 90% of people in our hallucinogen cohort were also dealing with polysubstance use and had other substance-related admissions. We aren't treating these psychedelic users in a vacuum. We are treating complex patients with multiple vulnerabilities and multiple substance use disorders. Our study highlights a critical challenge in modern psychiatric epidemiology research, the necessity of nuance in observational findings. Previous research that identified an association between hallucinogens and psychosis provided essential data and raised important safety alarms. The goal of our study is to add a layer of granularity by expanding the number of measured covariates to include outpatient data. Consequently, it is important to contextualize the patient presenting to the emergency room after using psychedelics, considering what predisposing risks may have led them to their current state and using this information to inform your management. Looking into the future, Research in this area must focus on phenotyping individuals who are at risk of psychosis with certain psychoactive substances, such as hallucinogens, psychedelics, and also we should be thinking about cannabis. As states consider further changing their legislation around these substances, we urge them to consider whether the safety data distinguishes between the effects of a substance and the underlying needs of the individual using it and tailor their legislation thusly. The resurgence of psychedelic research holds immense promise in treating multiple psychiatric disorders. Through thoughtful design and rigorous methods, we can build a safer framework for studying the utility and impact of these substances to better protect our patients. Thank you for your time. I hope you will read the full article and analysis in the Journal of Clinical Psychiatry.